Today I'm going to show you how to use a non-rebreather mask for oxygen therapy. We have a patient who the physician has ordered 12 liters of oxygen therapy for, so we know that we want to use a non-rebreather, partial non-rebreather of some sort. I do have the non-rebreather mask. It has a one-way valve on the inside, so we are going to use this for our 12-liter demonstration. So the order has been checked. We have checked the patient's chart. We make sure we have the correct patient room. So we enter the patient room by knocking, introduce ourselves. Hi, I'm Tricia with Respiratory Care, and I'm going to help you with your oxygenation. It sounds like you are not able to catch your breath, having a hard time breathing, oxygen levels. We would check via some sort of guide, and we would use our pulse oximeter. This is what I have today, so we'll use this. For instance, we have a patient who is oxygen saturation is 78, 79%. So we would get this mask on as quick as we can. We would get our adapter connected correctly to our flow meter. Make sure that is sealed and that's coming out the bottom there. We would connect our tubing to that adapter. And we would turn that to the 12 liters. So 12 liters, you can hear that going through there. We would place the mask just like a simple mask, up over the nose, down over the chin. We're gonna turn this oxygen off here. Up over the nose, down over the chin. This would go up over so it fits securely, and have this. We don't want this to be occluded at all, so we would have this free of blankets or anything on top of this with the patient. So with this particular setup, when the patient breathes out, this bag would inflate. Then when they breathe in, they're going to rebreathe that oxygenated air, and this should never collapse. This should be at least a half to 3/4 full. Like I said, we don't want that to collapse. And like I said, the patient will breathe out. It would fill this bag. When they breathe in, they're going to suck in that oxygenated air. That is a one-way valve for that non-rebreather. This can be used for a minimum of 10 liters, so it needs to be 10 liters or above. Like I said, this patient is requiring 12 liters, so we would put that on and we would continue to monitor that patient via oxygen levels or ABGs, however the doctor sees fit to monitor that patient. As soon as the patient starts to improve, then we would want to reduce them to a simple mask. More improvement, we would want to reduce them down to the nasal cannula, especially if it's a patient that doesn't wear oxygen typically. They come in, they don't wear oxygen at home. We want to try throughout their hospital stay to get them off of oxygen completely if we can.